Hello friends, in this video we are going to talk about a condition. That condition is called as xanthelisma, and typically we talk about xanthelisma palpebrarum. It's a condition where we notice yellowish depositions which are painless beneath the skin around the eyes, the upper eyelids and the lower eyelids. And in an age group of 15 to 57, almost 60 years of age, almost you will see more in the people adult, and it's more common in females than males. This condition is because of increase in the cholesterol level in our blood, and that gives eventually this condition called xanthelisma palpebrarum. Now, why this happens and what are the treatment options, how can we prevent it, we are going to discuss in this video. First and foremost, let's understand why this happens. It happens mostly in people who have hyperlipidemia. That means they have the increase in the cholesterol level, especially the bad cholesterol LDH. Second, it happens in people who have diabetes. It is more commonly seen in people diabetic or people who have thyroid abnormalities. So that's called metabolic syndromes, metabolic disorders. People do have, in such people you have more of an xanthelism. Now, but it is equally seen in people who don't have. In 50% of cases, you will have in normal people who don't have higher lipids in their blood, but still they get xanthelisma. In such cases, it is because of their inheritance, because their parents do have it, or some other cases you will find it, the reasons and all. Now, what are the preventions? And later we will talk about the treatment. The prevention is simply you have to modify your lifestyle, you have to have a regular exercise plan, you need to control your weight, you need to control your fat intake, especially all the foods that will increase your glycemic index. You need to control that so that your cholesterol level in your body is controlled. Okay, if it's beyond that, if the cholesterol level is still not being controlled with your lifestyle modifications, then we can go for the medication, statins, which are some statins, some more commonly used for this high cholesterol whenever you have the high cholesterol in your blood. Now, coming to the treatments. Now, when it comes to treatment, you have the surgical and the non-surgical. It's mostly done by dermatologists who practice dermatosurgeries. Surgically, we remove that part of the skin where you have these depositions and suture it back. Within a week time, the healing is complete and you will have normal skin in that area. However, many cases, because considering it has a recurrence rate of more than 40%, so sometimes people opt for non-surgical stuff. In non-surgical things, we have the chemical cauterization where we use 100% of TCA that can remove this cholesterol, but that's a recurrent application is required. The second is radio frequency removal. With the radio frequency, we remove those the cholesterol depositions. And lastly, the cryotherapy, where we use liquid nitrogen to remove those cholesterol depositions. So this is about xanthelisma. If you have any questions, queries related to xanthelisma, we are happy to help you. Thank you very much.